Hello, this is Dr. Stanley Lang, and welcome to this broadcast, which is on the topic of how to lower the blood pressure quickly through natural means without taking any supplements to do it. And not that it's wrong to take some supplements, but in this case, the story doesn't involve any supplements. And I'd like to tell you about the story of a patient that I've been seeing for over a year. His blood pressures have been running high. I see him intermittently, but he was starting to get more alarmed because his bottom number had risen to approximately 108 on the bottom, and the top number was 190 to 200. And so he had been in that range for a few months, and he knew that he wasn't living a good lifestyle, but he wanted to know if there was a way that he could lower his blood pressure by lifestyle without using medications. I told him that he was in a stage of hypertension where normally 2 medications would be used. And so he understood that going into the dietary strategy. But when I saw him back today, his bottom number had dropped by 15 points. His top number had dropped by 25 points. And so he had dramatically lowered his blood pressure, and he is still on the way down, of course. And this is just less than 3 weeks into this strategy. Now, he's also reporting that he's sleeping much better, his focus is much better, his energy is much better. So there's a lot of benefits to using lifestyle changes to lower the blood pressure as opposed to using a couple of medicines, because we're fixing the underlying broken chemistry. So blood pressure doesn't just go up for no reason. What is called essential hypertension almost always is related to insulin resistance syndrome. And so this is fixable if you know what you're doing, and it's easy to know what you're doing. If you're not quite sure what to do, though, I encourage you to get the free book that's at the bottom of this video. Now, I'm not guaranteeing that your blood pressure is going to drop using this strategy, because there are other causes of blood pressure elevation besides insulin resistance syndrome. And I'm not suggesting that you stop medication if you're taking it now, but this is a patient that patients who have been able to wean off of their medication by following the simple program. So hope you get the book if you're not familiar with the concept. I wish you well. God bless, and have a great day.